Kia ora koutou katoa and good afternoon, everyone. I'm going to hand over to Dr. Bloomfield shortly to provide an update on case numbers, but I first want to give a very quick update on the flooding in Auckland. As you'll have heard, thunderstorms and heavy rain in the early hours of this morning has caused severe flooding and damage in parts of West Auckland. As at 10 a.m. this morning, Fire and Emergency New Zealand had responded to roughly 370 incidents involving mostly flooding, power lines down and trees down. Auckland Emergency Management is undertaking preliminary reconnaissance in the affected areas. There will be no definitive numbers with respect to damaged properties and affected people until that assessment has been completed. However, we know a number of households self-evacuated as a result of the storm. If people are in need of shelter or support, they can report to the Auckland Council building at 6 Henderson Valley Road, where they'll be triaged appropriately. And of course, staff there are doing all they can to maintain public health protocols as much as they can. But we are being pragmatic. Emergency situations and evacuation advice overrides alert level requirements. The most important thing is keeping people safe. If you're advised to evacuate by authorities because of an emergency, please follow that advice. And of course, we understand that the situation will mean that there will be some bubbles who by necessity are joining other families simply because they need shelter. Please call 111 if life, health or property is in danger. Emergency services continue to operate. Check Met Service online for the latest on weather for your region, your local council or civil defence group website for instructions and advice, and NZTA for any road closures. Now, 2 drive-through vaccination centres, Trust Arena and Airport Park and Ride, they closed temporarily due to the impacts from the storm, but both have now reopened. The Airport Park and Ride drive-through vaccination centre in Mangere reopened shortly after 9 a.m. after 2 marquees that had come down were re-erected and repositioned in order to restart vaccinations. The Trust Arena drive-through site moved inside for the day and reopened at 10:30. People will be directed to park on site and asked to enter the stadium to be vaccinated rather than stay in their vehicles. The usual drive-through model we expect will reopen tomorrow. Anyone who was impacted by the late opening was not able to attend their appointment this morning will be contacted to reschedule their bookings for later in the week. Finally, I know for Aucklanders, this weather event must feel like another blow at an already incredibly difficult time, and some of the damage I've seen to people's homes is just devastating. Please do look after yourselves. Do reach out for help and support. It is available to you. I'll hand over to Dr. Bloomfield.
Thank you, Prime Minister. Kia ora koutou katoa. So today there are 49 new cases of COVID-19 to report. All of these are in Auckland. Obviously, that's a further decline on yesterday's daily case number, 4 fewer, and is our lowest number of cases in 6 days. It does provide a further reassuring indication that our public health measures are rapidly slowing the spread of the virus. Of note, 66% of new cases reported yesterday, that is to 9 a.m. yesterday, are household contacts of an existing case rather than from exposures in the community. And of yesterday's 53 cases, 77% did not create any exposure events, implying that they have either been isolating since lockdown started or since being identified as a contact, thus reducing potential new chains of transmission. Of the cases we reported yesterday, only 23% therefore are considered to have been infectious in the community, compared with 30% the day before and 35% the day before that. Now, these cases who have been infectious in the community may simply have been visiting the supermarket or a healthcare provider, or indeed they may be an essential worker. Furthermore, based on our updated modelling, the reproduction rate of the virus in this outbreak is now looking like it is remaining under 1, which means cases will continue to decline and we are successfully breaking chains of transmission. The seriousness of COVID-19 infection is also very visible to us, with today 33 people in hospital, including 8 in ICU or high dependency unit, and of those, 2 are being ventilated. These hospitalisations obviously have an outward ripple effect on our communities and whānau, and my thoughts are with those individuals and their whānau. It's also sobering that of the current Auckland outbreak, 6 cases are under the age of 1. All this information reinforces the importance of us doing everything we can to stamp out the virus. That includes strictly sticking to the alert level framework and getting vaccinated when you are eligible. This is our best chance to do it. We are making a difference, and we need to continue to do so. I'd also like to stress that it's important for anyone who needs any form of healthcare that it's important they do so when they need it. Do not delay care. Hospitals across the motu, including at Tamaki Makaurau, are safely managing anyone needing hospital level care. All services are operating safely under alert level 4 protocols. Finally, yesterday was another big day on the testing front with 16,755 tests processed nationwide, the vast majority of those in Auckland, and many of them picking up the day 12 tests for our close contacts. Our 7-day rolling average is 31,600. This ongoing high rate of testing is important for us maintaining confidence that we are finding any cases of COVID-19 out there. So just to reiterate, if you have symptoms, wherever you are in New Zealand, get a test. And of course, if you have been at a location of interest, it's very important that you isolate within your bubble and get a test. There is more detail in the Ministry's 1 o'clock statement today. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. As everyone will now know, at 11:59 p.m. tonight, all of New Zealand south of Auckland will move to alert level 3. So I want to go over what that looks like and remind people of the tools that you need to use to restrict any risk of COVID spreading. As I said yesterday, level 3 is progress, but it is a setting that still requires a high degree of caution because the risk of COVID in the community remains high. Bubbles stay in place at level 3, although we know there are some people who are isolated or have care needs for children or the vulnerable, which mean bringing in another family member, for instance. Now, while this can occur, it must remain small and exclusive at level 3. A reminder that it's not until we get to level 2 when you can start having contact with those outside of your bubble again. More businesses can open at level 3, but only in accordance with strict rules. Because Delta has changed the rulebook, we have had to change too. That means that contactless delivery and pickups can occur, but all staff and customers are now legally required to wear a mask for those outwardly facing businesses such as supermarkets, pharmacies, butchers, greengrocers, takeaways and petrol stations. And to everyone else, we encourage you to wear a face mask whenever you're out and about. The latest science tells us Delta spreads very easily, and this is a tool that really does make a difference. So here are the golden rules for everyone south of Auckland for the next 7 days as we enter into alert level 3. Stay at home, keep your bubble small, and exercise and shop locally. Keep your distance from people. Delta is highly infectious. Continue working from home if possible, and keep children and young people at home with you. At alert level 3, children should only go to school if their parents are essential workers who are required to work and there's no other option available. So for the most part, schools and other learning centres remain closed. Public venues remain closed, for example, libraries, museums, cinemas, food courts, gyms, pools, playgrounds, markets. Travel is restricted for work, those who fall into that category of being able to access education, and to pick up necessities and goods purchased in a contactless way. And of course, we continue to ask people to keep their recreational activities as local as possible. And if you haven't been already, get vaccinated. From tomorrow onwards, all people 12 years and over can book a vaccine. There are things you can do at level 3 that aren't part of our highest alert level. You can, for instance, order from local cafes, restaurants and retailers as long as you don't make contact when picking up those purchases or having those purchases delivered to you. Weddings and civil union ceremonies, funerals and tangihanga are allowed for up to 10 people. Other gatherings such as faith-based services, sports games, social events are not permitted. We know from this outbreak it has been these types of gatherings that have seen the spread of COVID-19 the most. Some messages now for businesses. If you own or run a business and that business requires close physical contact, you cannot operate. Businesses and services must be contactless and meet safety requirements, including physical distancing, having extra hygiene measures in place, such as staff wearing face coverings and contactless options for ordering, pickup, delivery and payment. In line with the move to Alert Level 3, the boundary to the south of Auckland will come into effect at 11:59 p.m. tonight. I want to now go over the rules around crossing that boundary. Personal travel between alert levels is highly limited and includes things like emergencies, care or support for someone in a critical or terminal condition or shared childcare. All other situations in which travel is permitted are listed online on the main COVID-19 website. Business and work travel across the Alert Level 4 and 3 boundary is also strictly limited. If you work for an Alert Level 4 business or service, you are permitted to travel across the boundary for the purposes of that work. You will need business travel documentation. These are being processed by MB, a job they started several days ago when those applications started coming in. If you haven't applied already, you can do so at business.gov.nz. A quick reminder of why the boundary is there in the first place and what we're trying to achieve here. We're trying to stop the spread of a particularly infectious and tricky virus. So please do not cross alert level boundaries unless it is for those serious reasons that we have set out. Otherwise, to conclude, we have a second day where our numbers have declined. We want that trend to continue, but we do have some hard work in front of us still. We want the tail of this outbreak to be as short as possible, but that is up to all of us. So to everyone, please do stick with it. And as we transition to level 3, please do remain absolutely cautious. Yeah, Jessica.
Any information about, you mentioned 6 children under the age of 1. Do you know how many are under 12? And how is it affecting children who are that young? Are they seriously impacted?
If you don't mind, I'll have Dr. Bloomfield cover it.
I don't have further detail. We are updating the demographic breakdown of the people in the outbreak each day on our ministry website, so age, ethnic breakdown. None of those younger children are in hospital. I think the youngest person in hospital is 18. It does tend to be less severe in children, but it just does go to show this is reaching right across the age groups. And I think it's 2/3 of our cases are under age 34, so it is very much in that younger group at the moment.
Hi, this is Dr.
Jessica, I'll let you finish on that.
We've had reports with the flooding of people going in and helping other people get out of houses and things like that. What should they do now if they have burst those bubbles? What's the advice?
Look, our advice is in an emergency situation, the emergency takes precedence. We have to be practical here. We absolutely understand that these were situations in which people's lives were threatened or they may have been gravely injured by the events around them. So the priority was their safety and getting people out. For those where there may have been contact with others, of course, that may be a natural byproduct of just evacuating people. Just continue to keep an eye on your symptoms. Try and get back into those bubbles as much as you're able. We are there to support people to find new accommodation so that they can get themselves back into a safe environment.
Dr. Bloomfield, how many cases
have been unable to be linked back to the outbreak, both epidemiologically or by location of interest, and how worried are you by mystery cases?
51 at the moment, Dr.
Yep, so total of 51 of all the cases, which I think is 610 now, haven't been yet epidemiologically linked. But of today's 49, only 19, it might have been 17, I think, by this morning when they reported, hadn't already been epidemiologically linked.
Are those unlinked cases, and how worried are you about further mystery cases?
Of course, we want to find out the epidemiological link. Sometimes we can't find, and when I say that link, this is the exact person that they were infected by. But of course, the whole genome sequencing, which is being done apace as well, helps us to link those cases to the outbreak. So at the moment, there's nothing that our AFS colleagues in Auckland are reporting as concerning about cases springing up, but that's obviously what we would be interested in looking for.
And one of those, we also, of course, 10 of the unlinked are 6 or more days old. And what we've seen is those unlinked cases actually over time have reduced as, in some cases, new cases when they emerge become the piece in the puzzle that's required to be able to connect the dots. But as we go on, we are keeping a very close eye on those unlinked, because that will tell us whether or not we have potentially chains of transmission that could lead to additional cases in the community. And those are the numbers we need to bring right down.
I'll
let Tara finish and then I'll come over to you, Jason.
Just to drive home how serious Delta is, could you give us a sense of the condition those patients in hospital are in, particularly the ones in ICU and HDU and on ventilators?
Well, I think it's enough that they require hospital-level care. That's, so they are, if you think about being unwell enough to be in hospital, that's important. Most of them are in older age groups, but clearly, again, the number that are in ICU is indicative too. And what we've seen from overseas is it seems that Delta, the hospitalisation rate with Delta is about twice what it was with the earlier variants, and that would be the pattern we're seeing, somewhere around 6 to 7% of people. And if you think about the age distribution, that's probably even more significant, that 6 to 7% of people are in hospital.
And you look across at Australia and they too are experiencing very high rates of hospitalisation as well in their outbreak, and I think it really is indicative of the extra danger that Delta really does present.
Prime Minister,
Jason, and then
we've been advised that there is a positive case of COVID-19 detected at the Spring Hill Corrections Facility. Could you please, A, confirm if that's true, and B, give us a little indication of what the protocol is in terms of this location?
Yeah, so Dr. Bloomfield, do you want to start?
I'll start there. I've got some information. Yes, so this person had identified themselves as having been at a location of interest and immediately isolated and got tested. It's one of the corrections officers at the facility. Corrections were informed last night, and suffice to say, under Alert Level 4, they already have very strict protocols around minimal contact between staff and inmates, and also use of PPE and so on. They will be putting out some more information later on, but essentially at the moment there are 23 staff who had contact with this case at work. They're already isolating and being tested, and likewise there are 123 people in the unit where the staff member had worked who have also been segregated and they're being tested, and they're also looking at whether there may be a role for just testing the wastewater there just to get a sense of whether there's any infection in the actual facility.
They also keep rigorous record keeping, as you would imagine, in a corrections facility regardless, which will enable them to undertake contact tracing, and the officer in question is fully vaccinated.
So what happens with the prison at that stage? I assume that all the people there would be essential workers. Are they isolating from home? And if so, how is the prison run?
All of the 23 staff who had contact with the person at work have been told to isolate and get tested, and all those inmates who may have come in contact with that individual are also being tested.
So who's running the prison?
Well, obviously there are shifts, so they work on a shift rotation, so obviously they're being able to still...
Are all the inmates in that prison vaccinated at this point?
Sorry?
Are all the inmates vaccinated?
I would need to... Obviously, you've heard that the prison officer is fully vaccinated. I haven't got details beyond the prison officer. Of course, that was where we were quite interested, and they were asymptomatic also. But if you'd allow me just to go and get a little bit more detail on what the wider environment was for them. You will know that generally our focus early on was that we considered generally residential environments to be high-risk environments. But if you'll allow me to just go and check on the status.
So overseas, so the prisons also...
North Waikato, is that...
I'll let you finish, sorry.
Spring Hill is not in Auckland.
Yep.
Potential exposure site here outside of Auckland. Is that what...
Yeah, but you'll know that it's obviously serviced very heavily from staff coming into that region. And so ultimately the people we're worried about are the individuals in that workplace who have had contact with that staff member, and they have all been contacted and are isolating and and are being asked to get a test.
Under Alert Level 3, just on the...
Yeah, I'll let you, and then I'll come to you.
On the prospect of Alert Level 2 and the South Island, the South Island hasn't had a case for 300 days, and everyone down there who was at an Auckland hotspot has basically completed 14 days of self-isolation. Will they be able to go to Level 2 in a week's time, or will they need a full 2 weeks?
So we've said we'll review in a week's time. And we are keeping our options, really keeping options open there. So we will undertake a very genuine risk assessment about the ability to move alert levels. It's certainly not the case that we've predetermined it has to be 3 weeks. We haven't. We will very genuinely, after 7 days, assess that risk and make a decision based on it. And yes, we haven't had a case in the South Island for a long time, and we want to keep it that way. So that's our goal. If we can get them up to fewer restrictions safely, we will.
It's looking fairly safe though, right? I mean, could you imagine Level 2 for South Island, Level 3 for North, Level 4 for Auckland, for instance?
I don't want to get ahead of some of those decisions, but what we do want to ensure is that we have borders that can maintain, if we are in that position, that can maintain that safely. But our goal is to get everyone back to the fewest restrictions possible as safely as possible and not make decisions that might be just a bit premature. So we're going to give it a week and then we'll very genuinely make that risk assessment.
Under alert level 3, there will be a whole lot more staff being called back into their workplaces. Some of them may be nervous about that.
Yeah.
Some of them may have mild health conditions, asthma. What's your guidance in that situation?
We would not have moved to an alert level 3 environment unless we felt that it was safe to do so. And you will have seen our risk assessment slide up the scale for Delta. So where we might have usually gone for a 3, we've gone for a 4. Where we might usually have used a 2, we're using a 3. So you can just really see that adjustment in the way that we're using our settings. So to those individuals, I'd say we wouldn't have made this decision unless we felt that we were in a position to do so. And we've really considered whether or not we believe that we have a risk of COVID in the community. Our assessment based on the information we have is that it's safe to move to more people coming into those work environments. However, we're still being cautious. So if you have symptoms, please get a test. If you're sick, stay home and stick to your bubbles. We really are still restricting contact and movement at this level. Do you have anything you want to add for those who might be immunocompromised in those level 3 areas, Dr.
Look, I think people should talk to their employer. However, it's, as the Prime Minister said, whether it's alert level 4 or 3, the precautions in the workplace obviously are the same. And so we're strongly encouraging people just to take exactly the same precautions they're taking in alert level 4.
Yeah, just back on the flooding as well. Obviously, there's never a good time for a flood, but this is particularly bad timing.
Absolutely.
How much of a setback could this be to our battle against COVID?
Look, there's nothing I've seen to suggest that it necessarily would be a setback, but nonetheless, it doesn't make it any less of a devastating event for those individuals involved. Already they had the stress and fatigue of 2 weeks of lockdown, and now some of them have lost their homes and everything in it. It's just devastating to see. At this stage, my focus is not on whether or not this has set back our COVID response. I do not believe it has. My focus is how do we look after the well-being of those families. Claire, I'll come to you and then over to Jenna.
Are there any further updates on the investigation or whatever into how the Delta made it into the community in the first place?
So I think the last update we may have given you was that we've conclusively ruled out any link between there was a theory around potentially someone connected to the Crown Plaza working within it and a location of interest where we had someone with early symptom onset. We've conclusively ruled that out because they've had 3 different varieties of testing that have demonstrated that they did not have COVID-19. That means that we are no further along in that case investigation. But what I can update you on is that we do, the Crown Plaza continues to be empty. We do have those who have specialist skills in ventilation working alongside public health, going through doing another assessment of that facility to see what other improvements could be made. You'll know that it wasn't one of the facilities we had issues with, but we are wanting to go through and look at it, as I've said, with that Delta lens to see what else could be done. Anything else on the source investigation, Dr.
Just to say that really we've gone down a number of roads and they've all turned out to be dead ends so far.
Yeah.
So we may never find the exact way that the virus got from facility into the community, but we are very confident that that's the place where it came from.
We're going to break away from the news conference now, but you can keep watching on our website, newshub.co.nz. Just recapping those key points from today, there are 49 new cases of COVID-19, all of them in Auckland. That's 4 fewer than yesterday and much lower than the day before that. 33 people are in hospital, 8 in ICU and 2 are being ventilated. 6 of the Auckland cases are aged under 1. But the percentage of infections has been dropping over the last 3 days, which shows the chain of transmission is being broken and the alert level restrictions are working. Well, I'll be back at 4:30 with the latest, and Melissa will have a full wrap of the day's developments at 6 o'clock. I'm Tom McRae. Good afternoon.